So we talked about the biceps femoris. Now we're talking about the membranosis and tendinosis. It's critical. Right now we're going to show from the posterior aspect coming from the back. We're also going to show you how to come from the inside of the thigh out, because the semimembranosis is commonly associated with the adductors and groin discomfort or pain, as well as the tendinosis, and can be often affiliated with knee pain. So as we're in here working, you're going to pay attention to whether you're reproducing some of those symptoms that people are having. When you're getting into the membranosis, again, I want to get into the belly of the muscle. I can start down here. The membranosis attaches towards the back of the tibia here on the medial side. As Ashley bends her knee, go ahead. I can feel the tendon pop up into my hand and then relax again. And I'm basically looking for, go ahead and do it again, the feel, getting a sense of what that muscle is doing, okay? I can come at it from different angles. Go ahead and come up, and I can feel for that muscle belly tightening up. Now, when I'm ready to get into stretching, you can see the muscle belly here. I want to get in. My preference is when I'm working on these, I get in with my forearm first, because I can feel a more broad stroke into that muscle. Then I can shift over to my elbow and use my elbow to give a little bit more direct pressure and stretch. Again, coming from distal down by the knee to proximal up towards the hip. Ashley can interact with it by gently contracting the muscle, by bending her knee. She can feel the muscle tighten up into my arm and then relax it. I let Ashley guide me on depth. So if I'm putting pressure in and she says, you can give me more pressure, then I can lean in and give a little bit more pressure. If she says that's too uncomfortable, I'm gonna back out. But essentially, I gotta follow that muscle all the way up to the ischial tuberosity, which is here, all the way up near the butt. Because that's where the tendon is inserting into that area. And you want to work into that muscle, coming back, coming through it, finding where that muscle is tight, and then strumming through it. We talked about coming up along it. You also then want to come in and go across it, trying to get a little bit underneath the muscle and lifting it up as I push it out to the side. And you'll see us working on that when we come from the inside of the thigh, which we're going to do next.